Okay, hi everyone. My name is Adele, and today I would like to talk to you guys about a systematic review that I just did. The title is The Effectiveness and Tolerability of Daily Iron Supplementation in Reproductive Age Women with Iron Deficiency Anemia. Okay, so iron deficiency anemia occurs when the body does not have enough iron stores. It is the most prominent micronutrient deficiency in women globally. It affects over 4 million women. In the United States, it affects Black women the most, and then Mexican American women, and then non-Hispanic white women. Iron deficiency anemia occurs mostly due to excessive blood loss during the menstrual cycle, and then just low dietary intake and just a high physical demand. It causes symptoms like fatigue, weaknesses, dizziness, shortness of breath. It also causes anxiety and depression, and it makes you prone to illnesses. So there's two ways to, if it's just a regular iron deficiency anemia with no like really harsh medical conditions attached to it, two ways to prevent it. A is to figure out where the blood loss is coming. So as I mentioned earlier, it's typically from the monthly cycles, but sometimes some women do have digestive conditions that's causing bleeding from there, so that's one reason why they can be anemic. And then the other reason is your body has a hard time absorbing iron. So certain things like having the digestive conditions can also affect that, but also endurance exercises affects the body's ability to absorb iron. So World Health Organization recommends daily iron supplementation to include hemoglobin levels and iron stores. So the objective of my review was to determine if daily iron supplementation significantly improves mean hemoglobin levels in reproductive age women compared to no supplementation or placebo. And then in addition to that, the secondary objective was to explore adverse effects of daily iron supplementation regarding any GI discomfort. The primary hypothesis is that daily iron supplementation will increase hemoglobin levels, and then the secondary hypothesis was that daily iron supplementation will cause GI discomfort. So the study designs include randomized control trials. It included systematic reviews and meta-analysis. So the method was I used the PRIMSA guidelines to do a systematic literature review, emphasizing on randomized control trials, systematic reviews, and meta-analysis from the year 2007 to 2003. And I used the PubMed and Google Scholars, searching iron deficiency anemia, oral iron supplementation. And so that's really the inclusion of my method. And then the exclusion was like IV iron or male population or pregnant women. So I used about 4 randomized control trials article and about 5 systematic reviews. So the results were, one article did a study on soldiers in basic training to see if iron levels can raise their hemoglobin, also their physical levels, and then just the cognitive. And then in the end, they did find that daily iron did improve the hemoglobin levels. It also improved their physical, the 2-mile run that they had to do. And then they did like a cognitive mental health status to see how they're feeling. It also improved that. In comparison to the no iron, there was actually a decrease. I think the baseline was 37 at the beginning, and then after 8 weeks, it actually dropped. Those who were not taking iron dropped to 32. Another study looked at iron deficiency anemia for 16-week intervention. So they had a group that was giving 60 milligrams of iron, 80 milligrams of iron, and then like a placebo group. And they found that the iron was higher in comparison to those who did not take, that did not have iron supplementation. They also found that there was no difference between taking a 60 milligrams of iron or 80 milligrams of iron. Another study looked at intermittent iron supplementation compared to daily iron supplementation, and they did find that intermittent iron supplementation was just as effective as daily iron supplementation. However, daily iron supplementation was still recommended the best to increase ferritin levels. The one systematic reviews also corroborated this. All the systematic reviews corroborated that daily iron supplementation was the most effective in increasing ferritin levels and hemoglobin levels. However, all of them did report, or most of them did report, along with daily iron supplementation, that there was some GI discomfort, including like constipation, diarrhea, or just stomach ache. So then another study, they conducted to see if intermittent versus daily iron and how it affects the GI. And so it found that, again, intermittent is as effective as daily iron, and it did not have as much GI discomfort as daily iron supplementation. So that was really, really interesting to find. But in the end, the author did conclude that it is a intermittent, like alternate days, iron supplementation is effective. However, for those who really need to get their ferritin levels, it's important to consume daily iron supplementation. So the conclusion is, of all the meta-analysis, the randomized control trials, the systematic reviews, they all concluded that daily iron supplementation does increase hemoglobin levels and ferritin levels and just improve iron altogether. However, it causes GI discomfort. And so all the other articles that I mentioned, the ones that focus on alternating days of iron supplementation, they found that just as effective as daily iron, and it doesn't have as much GI discomfort as daily iron. So that's a really good alternative if you struggle with just GI discomfort, or just even like the routine of taking iron every day. If you struggle with that, that also helps. So in that case, I did accept my both hypotheses, and yeah, there's a lot of really good evidence out there and really good